So in this photo we can see the room where we have about 50 patients, 50 women having to survive to fistula. So that's very a nice room, but it's also a room where they can speak about what happened to them. Also, I see in this picture many patients that are there for 2 to 3 months. So they start to bond a special relation between each other, and they feel that they are like neighbors to each other. They have also mental health care, of course, but they can also discuss together about their loss of their child, because mostly the fistula is a consequence of a problem during the delivery. A lot of them also are divorced because of that. It's, yes, a room where you can see a lot of hope, but also they are trying as much as possible to survive to their wounds, to the loss of their child, and to the loss of their dignity. Sometimes they leave their younger children at home, so it's also difficult for them to be all alone for that amount of time, and also for them to be rehabilitated socially. Yes, on this picture we can see a midwife looking at a baby's well-being. It's one of the signs that we look at during a monitoring of a delivery. The delivery normally is few hours, 1 day max, and here it's more till 5 days sometimes. We don't see fistula, obstetrical fistula, for example, in Europe or in developed countries, because we have access to C-sections, but also vacuum extraction and these kind of things. When you don't have access to this, the baby is stuck, and it has a lot of impact on all the pelvis. And then when the baby is out, usually asphyxiated or dead, but also the woman will bleed a lot and will have this necrosis, which will have a lot of impact afterwards. Mostly what we see is even when they walk from here to the toilets, they are leaking urine. It's the same for the stools. They are also at a very big risk for infection, for infertility because of this infection, for stigma and social problematics, but also depression and psychological troubles because of this. So mostly we see women and girls who are very young, less than 18 years old, but sometimes even less than 15 years old. Their pelvis is not developed enough for a baby, which will be at term. So it can be also twin pregnancies, but it can be also women who have many children, and just by this one, the baby goes in a position that is not suitable for delivery, and then it gets stuck. Normally, when a midwife or any skilled birth attendant, we know it directly just by touching. But if there is nobody to know it, so then it can take days and days, and then have this consequence of fistula. The services that we provide in Jahun Fistula Center is operation, because it's surgery that is needed, and sometimes it's not just one surgery, but it can be consecutive surgeries. What we can see on this picture is a lot of shoes from different colors, and it's really representing for me the different women that we have and the different women that are arriving to our doors. It shows as well that there is no unique strategy to make it decrease so quickly. What we can say to prevent fistula to happen, it would be mostly to sensitize the communities about having safe deliveries and to access care quickly. So to sensitize men, but also mother-in-laws and older women from the community. It can be traditional birth attendants, it can be religious leaders, etc. They can provide the necessary decision to seek care without any delay. The second thing is to try as much as possible to talk about it during antenatal consultation, to explain the importance of having someone skilled to be able to deliver safely, but also to have the cost of the transportation already saved somewhere in the house. That's more and more what is done, and also to have the necessary equipment and skilled people all around the Jigawa state. For example, we have one doctor and one midwife who came from Somalia to be trained in Jahun, and they will open, inshallah, very soon a project in Somalia. But we have also other people from Nigeria who need to be aware of what is happening and how they can be trained and how can they benefit as well these populations. So it's a little bit of a community approach, but also a medicalized approach. It's really what is working well for us together to try to find the best solution for these women and girls.